Hello, Richardson ISD. Here I am out at one of our ISD playgrounds, and of course the main thing that's missing, that's our kids, and just want you to know how much we miss all of you. Also, as just a reminder, all of our playgrounds and all of our facilities are closed until we give you further notice of that. I hope this video finds you and your family doing really well. By now, every one of our students should have made a connection with their teachers. I've loved pictures that I've seen on social media and those you shared with me with our teachers coming into your homes for at-home learning. We know that this is a big adjustment for our families, and thank you so much for partnering with us. Next week will look the same as this week, as we are still in phase 3. Pre-K through second graders have already received their packets and will continue to work on those. 3 through 12 will continue to work with their teachers and their assigned choice boards. We also have resources that have been added to our parent and student resources. Check them out. One in particular was shared with me by a parent who created a useful schedule to manage her 3 sons' school schedules. It's really good stuff. Our number one priority in Richardson ISD is the safety of our students, staff, and all families. This includes both physical safety and psychological safety. Remember that we have counseling resources available to you at all times. One of the things we know from research done by child psychologists is that kids and adults alike are most distressed when we feel helpless and passive, and more comfortable and at ease when we're taking action. For this reason, we are really upping our communication with you regarding what everyone should be doing to stop the spread of COVID-19. Please share this information with your children and allow them to help keep your family safe by practicing hygiene routines that will slow the spread in our community. You could even assign all of your children to be safety monitors in your home. Let them police everyone on washing hands, disinfecting surfaces, coughing and sneezing in your elbow, and all of the other safety protocols that we should all be practicing. For our families receiving meals from us, there are some important changes to share from the state of Texas. Beginning Monday, April 6th, parents who are picking up meals at one of our 25 sites without children present will be required to show documentation for the students that the meals are for. Documentation can be a report card, a birth certificate, or a school issued student ID. Parents were sent an email message on Wednesday, April 1st from Richardson ISD that contained a verification of enrollment and showing that message to staff at a meal site will also serve as documentation for each child's meal being picked up. If you are able, we recommend keeping printed verification and printing messages in your vehicle or have them ready on the phone to make the meal pickup process easier for everyone. Remember, this new requirement is only for parents picking up meals without children present. Also, please remember that any child age 18 or under can receive meals at an RSD meal site. For the full list of meal sites and more information about meals for children, please visit www.rsd.org. Also, because the safety of everyone in our community is our highest priority, we want you to know that a system is in place to monitor the health and symptoms of the wonderful RSD staff members and volunteers who are preparing and distributing the student meals. And so you can plan ahead, I want to remind you that Friday, April 10th and Monday, April 13th are holidays on the RSD calendar. That means there will be no meal service on those days and no at-home instruction. We are working to provide weekend meal boxes for those families that may need them, and they will be available during next Thursday's scheduled meal service time. Meal sites will reopen and at-home learning will resume on Tuesday, April 14th. This leads me to my expression of heartfelt gratitude for all of our staff and volunteers who are feeding our kids each week. They truly are our heroes. This includes our child nutrition staff working every day, our transportation staff members who are distributing food, and volunteers who are assisting. As well, thank you to our community faith-based organizations. And in particular, I want to acknowledge the Network of Community Ministries and Cafe Momentum. They are working each week to provide thousands of meal boxes to go home with RISD families to feed them over the weekend. Many of you have asked for ways that you can help in our food distribution, and the best answer is to go to the Network of Community Ministries or Cafe Momentum's websites. They are community partners and they need your donations. Finally, I want to give you an update about the board meeting we had this past week, because at that meeting, we discussed grading and high school GPA and class rank. Our board made some excellent suggestions for us to consider, and following the meeting, we also heard from some thoughtful parents who asked us to consider some things as well. That's exactly how this should work, so thank you for your feedback. I've appreciated it. I've appreciated your input. Because of it, we're going to make a recommendation to the board this next Monday night that will include a way to include the third 9 weeks in our grading calculations and in our high school GPAs, as well as a hold harmless for a grade for the fourth 9 weeks to be sure that is fair for all students. So be sure to tune in to our meeting this next Monday night, and if that's relevant or of interest to you and your students. So in closing, and to reiterate, our priority is the physical and psychological safety of our community. If there is anything that we can do to assist you, your family, and your students at this time, if there's anything we can do or should be doing, please say something. Let's stay connected, and let's be sure that we are all doing our part, everything that we can do so that we can get back together as soon as possible. Be well.